spent a lot of time on television talking about the obesity epidemic, and we sort of thought that we should put our money where our mouth is and actually get off the television screen for a little bit and actually come into communities. So we're filming some of this, as you can see, for television, talking about integrative medicine. Let me just point out our guest, Dr. Brent Bauer, is head of the Integrative Medicine Center at the Mayo Clinic. The Mayo Clinic, arguably one of the most prestigious medical institutions in the country, and has an integrative medical center. So let's use that as a starting point. When you think of Mayo Clinic, you think of cutting-edge science, but you have this integrative medical center. How did that come about?
You know, I think what we're trying to do is make sure we give the best care possible to our patients, and so that means that some things we can't necessarily do with conventional medicine. Then we look for what else is out there. And so what we've tried to do is be very research-focused, study it, learn about it, and if it works for our patients, then we want to incorporate that and offer it to them. That's why we're offering things like massage and acupuncture.
You know, a lot of people are obviously eating a lot of food here today because it is a food festival, but when you talk about integrative medicine, is there something that can help with regards to controlling your weight? Controlling your overall level of fitness?
Absolutely. I think we've seen some really cool demonstrations today on yoga, Tai Chi, some fun dance exercises. Lots of this stuff from the realm of what people might call complementary medicine really can be a part of our health program. Certainly things like being mindful, the concept that we oftentimes eat and we don't think. We're not paying attention to what we're eating. So being mindful, practicing mindful eating is a concept that comes from this realm, that if we slow down, we actually do eat a lot less. So I think anytime we're thinking about bringing something new to our healthcare, we always want to include our healthcare team. Your primary physician, he or she, can really help you sort through what of this array, whether it's massage, acupuncture, herbal therapies, what fits for you as an individual. That's a good decision to make with your care team. After that, then there's a lot of things you can do for self-care, things that you can take responsibility for. For example, meditation. If you learn meditation is something you're doing for yourself, as opposed to having a physician or the healthcare system doing it to you. So I think being more responsive, more involved in our own healthcare, huge opportunity.
If you don't have the money to be able to find a doctor who can teach you how to meditate, or if you've never learned how to meditate, are there some tips you could give to help someone get started?
You know, absolutely. And right now we have the MayoClinic.com website actually has a little short video on there on a very simple guided meditation, guided imagery, completely free of charge, a great place to go and learn for 7 minutes a simple technique. Lots of other things like that on the internet, so even if money is a challenge, I think there's enough resources out there that you can at least dip your toe in the water and see, is this something that's going to work for me?